Hello, I'm Pete Lewis, Mayor of Auburn, and I'm here with Dr. Stephen Anderson, who is an emergency room physician at Auburn Regional Medical Center. We're here to talk today about prescription drug abuse. Now, first we need to talk a bit about this and some of the problems. And Doctor, why don't you tell us a little bit about your background and why you are so passionate about this issue?
Well, I've been in the emergency department at Auburn Hospital now for 25 years, and this is every night in the emergency department for those 25 years, where we see people that have unfortunately taken overdoses of medications either for recreation or deliberately. And the problem that I really want to emphasize today is that it's escalating astronomically fast over the last 10 years with really the influx of prescription drug abuse. So it's where I work, where I live, and it's in my community. So that's why it makes a difference to me.
And I think you've mentioned before that as some of the heroin was a drug of one era and cocaine another, but now the dramatic rise in prescription drug overdose and death is really the worst cause that we've got out there, the worst thing that's taking place. And I think you mentioned that earlier that it's overtaken auto accidents as a major cause?
Well, drug abuse has been around for thousands of years. In fact, they fought civil wars in China 150 years ago over opium. But around the 60s is when a lot of us thought that drugs for recreational purposes really sort of took off. But the death rate didn't climb much from heroin for 15 years. It climbed at a little bit steeper angle when we introduced cocaine. But in the last 10 years with prescription strength drugs, and the prescription drugs are all getting stronger over that 10 years too, but the death rate has climbed astronomically. And I think one of the statistics that just overwhelms me, the Department of Health classifies overdose deaths as a traumatic death. And in 2008, for the first time, drug abuse deaths from prescription overdoses has overtaken car accidents as the #1 cause of traumatic deaths in the state of Washington. It's an epidemic.
So you've seen this destruction going on in your ER, and I know that you work hard about it. What are doctors doing on one side, and what does the community need to do on the other side?
Well, we're in it together. And from the physician point of view, 2 years ago, the legislature realized that Washington was in the top 10 states in the nation for drug prescriptions for opiates, as well as overdose deaths. So recognizing this, they stepped in and said that physician groups had to come up with new guidelines and new plans in order to rein in both the prescribing of narcotics and thereby help rein in the overdose deaths, the addiction rates, all those other sort of things. Different groups have taken different approaches. I'm from the emergency department. This is really one of my issues, one of my top issues. So the American College of Emergency Physicians in Washington State actually led the way by adopting guidelines for prescribing of narcotics and opiates for chronic pain management through the emergency department. We're in essence getting out of that business. We'll always be there to take care of your acute needs. We'll even be there to help you with overdoses and withdrawal if that's what you need. But we don't want to be where you go to get refills of opiates or methadone. So we've actually adopted a 17-point plan.
So what does the community need to do?
The community needs to recognize that people aren't getting these narcotics from the local drug dealer on the street corner. It's not where it comes from. Over 50% of the drugs that are abused, opiates and prescription narcotics, come from a friend or a family member. Somebody gives them to you, or you grab them off the shelf at home where somebody hadn't used their leftover Vicodins or their leftover Percocets. So people need to recognize, first of all, open their eyes. It is an epidemic. It's out there. When you go to seek care from a physician, know that pain's a very real issue, but not all pain needs a narcotic. First thing to ask for is something that wouldn't be narcotic. If indeed you have a pain issue that requires a narcotic, recognize that it should be for the short period of time that you need it. And I would emphasize to people that if they've ever run out of a narcotic prescription and faced a real terror of where am I going to get more? Where am I going to get this refilled? It's Friday and I won't see my doctor till Monday. If they've ever faced that problem, it legitimately means that they have a problem. And they seriously should speak to their physician about that in an effort to try and come up with a plan so they don't get into that position, and ultimately, hopefully, get themselves onto a different pain management program. So that means you've got to be honest with yourself, be honest with your family, be honest with your physician. The second part of my answer, and it's a long answer, is all those leftover drugs that are sitting around. You're not going to use them. Statistics would say the most likely place they're going to end up is back on the street. So we need to come up with a way to get rid of those.
Okay, and I want to address that a little bit further, and especially for the parents, the grandparents, the aunts and uncles out there. Think about your medicine cabinet. Think about the pills that you got from the dentist because you had a toothache, you had surgery, and they're still there. You don't need them now. Think about the maybe minor surgery, or you had some back pain or something that went wrong, and you were taking some medication, and you've got a few pills left. All of us have kids and grandkids and nieces and nephews, and as they go through their early teens and around those times, they explore. If you've still got them there, you're telling them it's okay. If you leave them where it's available to them, we're saying collectively as a society, knowing how great this epidemic is, that it's okay. It is our responsibility as parents, and grandparents, aunts and uncles who have these children coming into our homes to make sure that what's on our shelves will not hurt the next generation, will not cause another generation of drug addicts. Now, I know with the hospitals and the police departments have been working together to find places where these drugs can be left off, where they can be made safe. But the first line, the first responsibility has got to be with each one of us in our medicine cabinets. When we have something on those shelves that can hurt another human being by misuse, we have a responsibility to everyone around us to ensure the safety of that product. So, Doctor, I know that this has been something, not just passionate, but you see the end result so many times. I know it's hard. Is there anything else that you'd like to say to us about this to really drive home this message? Because it's so important.
It's a real problem, and it's, again, not somewhere else, not somebody else. It's my child. It's my grandchild. I would emphasize that recreation is part of exploring when they're young, but it shouldn't involve recreation in the medicine cabinet. And when people do seriously have problems with their medications, if you will, addictions, abuse, problems like that, there are places to turn. You can always turn to the emergency department. We will always try our best to be there when you need us, but there are other places you can call as well. Narcotics Anonymous, drug hotlines, we can make numbers like that available. And I believe that if you're looking to get rid of your medications, I would say do it in a responsible fashion, not flush it down the toilet. I don't necessarily want my salmon swimming with my Vicodins.
We don't need any funny fish in the sound.
Exactly. But there are ways to get rid of it where you mix it with something that'll make it not palatable so no one will ever use it again. Or now I understand we have ability to drop it off in a safe place in this city. And that's a huge step that our city's taking. It's the kind of thing that communities need to do.
Very good. Folks, it is our problem. It is our problem right here in our city. It's a problem in our neighborhood. It's a problem in our household. These problems are happening for our children and our young adults, our adults, all through our community every single day. Everyone has got to do their part to end this newest epidemic in prescription drug abuse. Here is your chance. Here's your time to make a difference. Do you have something in your medicine cabinet? Come down to the Auburn Police Department. Find a way to do this to keep our neighborhoods, our communities, our children safe.
The streets aren't the only place kids find drugs. Sometimes they find them at home. You can help stop prescription drug abuse by safeguarding medications in your home, encouraging friends and family members to do the same, and asking your pharmacist how to dispose of medications you no longer need.
Hi, I'm Mayor Pete Lewis. Misusing medication can be dangerous, even deadly. To learn how you can help prevent drug abuse in our community, please visit safeguardmymeds.org. Hi, I'm Pete Lewis, Mayor of Auburn, and we're going to continue our talk about prescription drug abuse. Now, I have our Assistant Police Chief, Bob Karnofski, with us, and we're going to talk a bit more about this problem from the police side. Now, you've seen the problem grow in our city, and we've been talking about what we need to do, but I need you to talk about what you're doing, what you're seeing on the streets for this issue first.
Okay. Well, you may remember way back in the mid-'80s, Auburn had a product tampering case with Excedrin and cyanide being placed in it. And it was the only successful product tampering case in United States history. But as a result of that poisoning, that is where we got a lot of the safety product tampering issues as far as the cellophane around the shrink wrap on the top and the aluminum foil, and that totally did away with the two-piece capsules. So going way back 26 years, we've had experiences with over-the-counter and also some prescription issues. Some of the issues with prescription drugs go all the way from armed robbery at the pharmacies, where people are looking for specific types of drugs, robberies of people as they're coming out of the pharmacy. More likely, we're seeing residential home robberies of people that have prescription drugs. Usually people target the elderly because they have a variety of prescription drugs. Sometimes, unfortunately, it's family members that are aware of mom or dad or grandmother's prescriptions, and they steal them. So there's a safety issue that comes in besides the health issue with people using illicit drugs. Not only illicit drugs, but prescription drugs. Whether they're borrowing a prescription that's for somebody else, not knowing what the effect might be on their body, or just stealing other people's drugs.
And I know that the Auburn Police Department has really been proactive in this area, and that you've established a new way that our citizens can get rid of some of their prescription drugs.
Exactly.
Could you tell us a little bit more about that?
Yes, and part of it is not only safety by getting it out of the house, but also an environmental issue because so many people were just dumping their drugs down the toilet, which gets into the sewer system, it gets into lakes, it gets into streams and Puget Sound, and it creates a lot of issues. What we have done is joined with the DEA, and we have a secured lockbox in the police department lobby available 24 hours a day where people can come in and bring in over-the-counter medications. They can bring in their prescriptions no matter how long they're expired. We just don't take sharps like Lancets. We don't take body fluids of any type or IV bags, and we don't take certain liquids and aerosol cans. Even pet vitamins and pet prescriptions can go in there.
Oh, really?
So, and we have done 2 national take-back days with the DEA that's advertised nationally. On those 2 days, each day we've averaged over 60 pounds of drugs being turned in.
No my.
And every month we go through and we take out the drugs that are in the drop box. And those are disposed of as any evidence would be, and they're taken to incinerators and they're totally consumed.
Very good. Well, we've talked to our emergency room physician, and we talked a little bit about what we're doing as far as the Auburn Police Department and having a drop-off site. What are other things that our citizens should be looking at doing?
If they can't make it to the drop-off site, and what's really been good about the National Take-Back Days, it advertises the fact that we do have a drop box in Auburn. And we've been advertising that throughout the medical community and clinics and pharmacies also. One method that people can use is to take their prescription medication, dump it into a plastic bag, put in some coffee grounds or something, mix it up with water, seal it up, and put it in the garbage. that will render those prescriptions unusable, still not quite as safe as putting it into our lockbox because it doesn't go into a landfill.
Well, that is a great idea, and I think that the doctor had mentioned something about that as well. You know, I really appreciated the fact that we got to talk to one of our great physicians, and Chief, having you come in as well to talk about it from the police side. One of the things that we always have to remember, and both of you have said the same thing, is this is a community issue. This starts in our house, in our medicine cabinet, with our kids and our grandkids. It is about all of us working together to make this a better community. I really want to thank you for joining us in another program of Discover Auburn. If you have an idea of something you'd like to hear about, somebody you'd like to hear from, please do contact us and have a good day.